Hey guys, so I'm going to talk really quick about why we have all these images and what we're finding in the cervical spine. And so if you're someone that suffers with headaches or you have neck pain, maybe you've gone to the doctor and had an x-ray done. So typically what they'll find is that your mid to lower cervical can have some wear and tear to it. Now let me kind of explain this from a physical therapist perspective. Because an x-ray or an MRI is just a still image, so it doesn't show how the patient is moving. And so when a patient comes to me with this image, I have to explain to them that it's only a fraction of the big picture. And so that fraction tells us what you look like in just a fraction of time. Now, when we look at movement, so we have a spine model here, but I'll just point to my neck here. In the top of your neck, you have C1, C2, which does 45 degrees rotation each way. Now, we'll just take that joint and kind of simplify it. There's a lot of nuances to it, but if that joint itself isn't moving well, it's going to place stress to the lower portion of the neck. So the mid-neck and then the lower portion of the neck is going to take on more stress because the upper neck, which does half of your full motion, is not doing its job like it should. And so what that looks like is over time, the stress through the mid-cervical spine is going to lead to these kind of changes we see on x-ray. Now, it's nothing to be afraid of. It just means that we have to restore movement to that joint in the upper cervical spine to relieve the stress through the mid to lower cervical spine. And so treatment focused just on the mid portion of the neck isn't going to cover the full picture because it's still that still picture and it's not looking at the whole picture, the full body, or how the rest of the joints around that segment are moving. So what I would ask is if you're a patient with an x-ray or an MRI and you say that you have degenerative disc disease or you have foraminal stenosis or a herniated disc or bulging disc and it's C4-5, C5-6, I would suggest that you go see someone that can look at the full picture, that can assess your upper neck, that can assess your upper back and see how you're moving, and then get a proper recommendation from them and see if they can help you out with your symptoms. Thanks for watching, guys.